I think you already know, because it starts from right ventricle with the help of pulmonary trunk, and pulmonary trunk bring deoxygenated blood to pulmonary arteries goes to lungs, in lungs take place exchange of gases, and oxygenated blood through four pulmonary veins, two from right lung and another two from the left one, goes to left atrium. That is pulmonary circulation. And systemic circulation starts from left ventricle, where aorta starts, and finish in right atrium, where superior and inferior vena cava opens. And aorta, you already know that beginning of aorta has name bulbus aorta. Then next part, that is ascendance part of aorta. Then next it is this arc of aorta, arcus aorta, and descendens aorta, which is subdivided into thoracic and abdominal. And abdominal aorta then subdivides into common iliac arteries. You already know that from bulbus aorta to coronary arteries start, arteria coronaria dextra and arteria coronaria sinistra, and next time you will prepare branches of aortic arc. They are brachiocephalic trunk, left common carotid, and left subclavian artery. And brachiocephalic trunk subdivides into right common carotid and right subclavian artery. And next time you will answer common and external. Common carotid artery, arteria carotis communis, at the level of upper body of thyroid cartilage or body of hyoid bone, subdivides into external and internal carotid artery. Internal carotid artery have not got branches on the neck, only it supplies it goes into the skull and supplies brain, meninges, eyeball, and external carotid artery supplies external organs on the neck and head. And branches of external carotid artery consist of three groups: anterior group, posterior, and middle. Anterior group of branches. First of all, that is superior thyroid artery, arteria thyroidea superior. This artery supplies thyroid gland, and it gives superior laryngeal artery, arteria laryngea superior, which goes to the larynx. Superior laryngeal, that is branch of superior thyroid artery. Next, that is lingual artery, arteria lingualis. And lingual artery, it goes to the tongue and supplies it, and it passes through triangle. And you should repeat, you already know name of this triangle, that is Pyragov's or lingual triangle, trigonum linguale. Superior wall of this triangle, that is hypoglossal nerve, anterior wall, that is posterior body of mylohyoid muscle, and posterior body of triangle, that is venter posterior of digastric muscle. And last anterior branch, that is facial artery, arteria facialis. Facial artery goes to its surround mandible and goes to anterior surface of the face, supplies muscles of facial expression, skin, and goes to the angle of eye, and terminal branch of facial artery, that is arteria angularis, Next, posterior branches. Largest posterior branch, that is occipital artery, arteria occipitalis. And this artery, it goes to the same groove in temporal bone, sulcus arteria occipitalis, and goes to occipital region and supplies here muscles and skin in occipital region. That is arteria occipitalis. It also gives branch through foramen mastoidum to posterior cranial fossa and supplies here dura mater. Next, that is arteria auricularis posterior, that is ear. Here it is ear. And arteria auricularis posterior goes to external ear and supplies it. And last posterior branch, that is arteria sternocleidomastoidea. It goes to the same muscle, musculus sternocleidomastoidus, and supplies it. And last group, that is medial group of branches, and here it is, we have two terminal branches. They are arteria maxillaris and arteria temporalis superficialis. Superficial temporal artery, it goes in front of external acoustic meatus, goes to temporal region, and here it is subdivides into frontal branch and parietal branch. They are terminal branches of this artery, superficial temporal artery. And arteria maxillaris, it consists of three departments. Just a moment. And last medial artery, we already said that one is arteria maxillaris, another arteria temporalis superficialis, and last, that is arteria arteria pharyngea ascendens. Ascendens pharyngeal artery. This artery, it starts in the beginning of external carotid and pass in space between external and internal carotid arteries and supplies pharynx. Arteria pharyngea ascendens. That is last medial artery from external carotid. And now arteria maxillaris. Arteria maxillaris, it's that is, here it is mandible, here it is mandible. And arteria maxillaris has three departments. First, that is in place where this artery surround mandible, neck of the mandible. Second department, it is in fossa. Who remember what is the name of this fossa? This fossa on the skull, that is infratemporal fossa. And after that, it goes to another fossa. Who remember? What is it? Pteryga palatine fossa. Fossa pteryga palatina. That is three departments. First, behind the neck of the mandible. Second, in fossa infratemporalis, and terminal part in fossa pteryga palatina. In first department, it gives arteria alveolaris inferior, which goes to the mandible. It supplies teeth and skin of the chin. The same here, we have arteria meningea media. Arteria meningea media, that is largest branch of arteria maxillaris, and it goes to this opening. Who remember what is the name of this opening?
Foramen ovale?
No, ovale, that is here. Rotundum, it is here, and this opening, foramen spinosum. Foramen spinosum. Clear? It's passed through foramen spinosum, goes to medial cranial fossa, and supplies here meninges of brain. That is why name of this artery is arteria meningea, goes to meninges, meningea media in medial cranial fossa. In second department, arteria maxillaris gives branch which supplies posterior teeth on maxilla, that is arteria alveolaris superior posterior, arteria alveolaris superior posterior teeth on the maxilla. And here it is the same, it gives arteria buccalis to buccinator muscle, And in pterygopalatine fossa, one branch from arteria maxillaris, that is arteria infraorbitalis. Arteria infraorbitalis, first of all, goes to the, it passes through fissura orbitalis inferior and goes to the orbita, and in orbita it continues into sulcus infraorbitalis, then canalis infraorbitalis, and leaves skull through foramen infraorbitalis. And in time where this artery passes through canal, it gives branches to anterior teeth of the maxilla, that is arteria alveolaris superior anterior. It is branch from arteria infraorbitalis. It is arteria infraorbitalis, and branch of this artery, arteria alveolaris superior anterior. And another branch, that is arteria sphenopalatina. Arteria sphenopalatina goes to foramen sphenopalatinum. Look here. This is foramen sphenopalatinum, and from pterygopalatine fossa it goes into nasal cavity through foramen sphenopalatinum, and here it gives arteria nasalis posterioris, and it gives arteria palatina descendens palatine artery, which supplies hard and soft palate. Not necessary to draw it, is this diagram only for your understanding. And now what we can see in preparation. That is aorta. Here it is bulbous aorta. You can see right coronary artery. This is. Here it is left coronary artery. And left coronary artery only 2 centimeters, and then subdivides into ramus interventricularis anterior and ramus circumflexus. And right coronary artery, it's around right body of the heart, and gives ramus interventricularis posterior. Clear it is. And now arcus aorta, here it is arcus aorta, and arcus aorta gives, look here, it gives 2 branches. I already said right common carotid and right subclavian artery. That is from brachiocephalic trunk. Left common carotid artery, and left common carotid artery, and here it is left subclavian artery from arcus aorta. Well, here it is, that is vertebral, arteria vertebralis. It should start from left subclavian artery, but in this preparate it starts directly from arcus aorta. That is a variant of branches of subclavian artery. In normal, this artery starts from subclavian. Well, and here. That is common carotid, arteria carotis communis. It subdivides into internal without branches, there is no branches here, and external carotid artery. External carotid gives superior thyroid, arteria thyroidea superior, supplies thyroid gland, arteria this is lingual artery, arteria lingualis, and this one arteria facialis. facial artery goes to the face and pass through the mandible in front of masseter muscle. Here it is place of attachment of masseter muscle. Sorry. Here it is, should be here. That is part of the mandible. Here it is absent. Should be here, masseter, and in front of masseter muscle, arteria facialis goes to face, and continuation of this artery, that is arteria angularis. Arteria angularis. Next, here it is beginning of arteria temporalis superficialis here, and this one, that is arteria maxillaris. And arteria maxillaris, it gives arteria alveolaris inferior. This is here. Arteria from here, this is, and it continues to the mandible. Arteria alveolaris inferior. Here it is arteria, this one, look here, that is the largest branch, arteria meningia media. And here it is arteria, it's maybe arteria buccalis. The same here it is arteria temporalis profunda. And then arteria maxillaris goes to pterygopalatina fossa and subdivides into terminal branches. What else? Here should be this one. That is arteria pharyngia ascendens. It passes in space between external and internal carotid artery. And should be arteria accipitalis. Maybe here it is broken, arteria accipitalis, and auricularis posterior, impossible to see in preparate. That is all. Lesser circulation, arcus aorta, common and external carotid artery.